Hi, good morning. How are you?
I'm doing good. Good morning. How about yourself?
I'm doing good, thank you. My name is Niza-Valentin. I am a nurse practitioner student, so I'll be the one to taking care of you today. For today, we're gonna do a cardiorespiratory assessment.
Okay.
Okay? So before that, I have a questions for you. As of the moment, are you experiencing any palpitation or chest pain?
No, none.
Okay, any shortness of breath, difficulty breathing?
No, none.
Okay,
Whatsoever.
good. So I'm gonna wash my hands first before we start the assessment, okay?
Okay.
Okay, so I already washed my hands. So first, we're just gonna do the assessment of the skin first.
Okay.
Okay, so I'm gonna check for your conjunctiva. It's pinkish. Your lips is pinkish. Skin, there's no bluish discoloration, which is cyanosis. No yellowish or jaundice. Now I'm gonna hold your hand. It's warm to the touch. Then I'm gonna check for the capillary refill. Okay, it's less than 2 seconds. There's no clubbing on your nails. So that's good, okay? Now I'm gonna check out your back. We're gonna start first with the posterior part of your chest, okay?
Okay.
So it's gonna be the same. I'm checking for the skin color. So everything is good. And now I'm gonna check if there's any scar or any lesion that are visible. Okay, that's good. Now I'm gonna check if there is a signs of symptoms of respiratory distress, which is if you're using an accessory muscle. Okay, good. Now I'm gonna check if there is a visible chest deformities, like if there is, can you straighten up your back? Okay. So there's no lordosis, kyphosis, or scoliosis, so it's good. Is it okay if I'm gonna palpate? Okay.
Sure.
Now I'm gonna inspect and palpate, like your shoulders, scapula, to check if there's any tenderness. Let me know if there's any tenderness, okay? Pain. Okay, there's no mass.
No.
Okay. That's good. Now I'm gonna need to do the noting for the rate and the reading of your respiration. Okay, so I'm gonna do like a full 1 minute.
Okay.
Okay, respiration is 16th and in the normal rhythm. Next, we're gonna do a palpate for the symmetrical of the chest expansion, okay? So I'm gonna put my arms over here, my hands, and then I want you to breathe normally. Okay. Another one. Okay, good. Now I'm gonna do the tactile premitus. Okay, so every time, this is my palm. So every time I'm gonna touch in the skin, you need to say 99. Okay?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. So both, I can feel like the vibration. I can feel the vibration, so it's good. Because if there's an absence of the vibrations, meaning that, there's something going on in here, like pneumothorax or pleural effusion. Okay, so that's good. Now I'm gonna do a percussion. So going straight. Okay, so I can feel that I can hear that it's a resonance, so
Okay.
which is normal. Now we're gonna do the diaphragmatic excursion. So diaphragmatic excursion is the movement of your thoracic diaphragm when you're breathing. Okay.
Mhm.
So go straight first. We're gonna hear. It's better like this. Okay. Okay, here. Okay, so it's here, and another one here. Okay, so probably it's here, so it's like 3 centimeter. Okay, so the normal is like 3 to 5 centimeter.
Okay.
Okay, now I'm gonna do the auscultation. Okay, so every time that my stethoscope, the diaphragm is touching your skin, you're gonna take a deep breath. Okay. Okay, so it's a normal vesicular breath sound. Sorry. Now I'm gonna assess for the lateral lung field. So this is your left. So on your left, I want you to do this.
Okay.
So, okay, it's good. I'm gonna do the right one. Okay, it's good. Now we're gonna do the special test. So first one is the egopony. So every time that the same that it's touching your skin, you're gonna need to say E. Okay?
E. 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 E.
Okay, good. So I can really clearly hear the letter E because the abnormal one is when I'm hearing a A, so meaning there's a consolidation on your lungs, meaning like you have a pneumonia, like that, okay? So the other test is, we call it bronchopony. So with the bronchopony, it's the same too, it's the same test for like for pneumonia. But the bronchopony, you need to say, instead of E, you're gonna say 99, okay?
Okay. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. So with that, I cannot really hear it like very clearly. So that's normal, okay? Because if it's very clear that I can hear the 99, then there's pneumonia. So the last one we're gonna do is the whispered pectoriloquy. So with that one, you need to whisper 1, 2, 3. Okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. So that's good. It's the same as the bronchopony. I cannot really clearly hear it. So it's good. So there's no consolidation in your lungs. And And now we're gonna do to check for CVA tenderness. So this is to check if there is like, you know, pyelonephritis, there's something on your kidney. Okay, you need to tell me if there is like a tenderness, okay?
Okay.
How is it?
No, none.
Okay, so it's good. Now we're gonna move on to the anterior chest, so I want you to face me here. Okay, so with the anterior chest, it's gonna be the same. We're gonna check first with the skin color. So there's no bluish discoloration, there's no cyanosis, jaundice, there's no scar, there's no lesion. Okay, so next one is I'm gonna check for visible chest deformities. Okay, that's good. And the next one, I'm gonna palpate for chest symmetrical. So the same that what I did in the posterior. Okay, so I just want you just to relax. Okay, so here, maybe here. Okay, so I want you to breathe normally. Okay, it's good. So it's symmetrical, the movement is symmetrical. Now we're gonna do the tactile parameters. It's gonna be the same in the palm of my hand. So every time that I'm touching the skin, you need to say 99. Okay?
Okay. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, good. So I can feel the vibration. So there's no air trapping, or you know, there's no pneumothorax or pleural effusion there. Okay. So now I'm gonna do the auscultation. So every time the stethoscope will touch on your skin, you need to take a deep breath. Okay.
Okay.
Okay, good. So it's mostly vesicular breath sound, only here in your trachea, that is a tracheal breath sound. Okay, so it's good. Now we're gonna do. Okay, so we're already done with the respiratory. Now we're gonna move on to check for your cardiac. Okay, you okay?
Yes.
Just breathe normally first. Okay, that's good. Okay, so first I'm gonna check it first the diaphragm here, because on the diaphragm it can catch up a high pitch sounds. On the bell sound, and the bell one you can catch a low pitch. Okay? So S1 and S2, which is the lub dub, you can hear it on the diaphragm, and the S2 and S4 in the bell. Okay?
Okay.
So we're gonna do first with the diaphragm. Okay. Okay, just sure. Okay. Okay, so can you like put more like, thank you. Just like that. Okay. First intercostal phase. Okay. So I'm gonna listen for the aortic first. The aortic is in the second intercostal space of the right. And the pulmonic is in the opposite side, which is in the second intercostal space on the left. Okay. And then the Erb's points is in the third intercostal space. Okay. And the tricuspid is in the left lower sternal border in the fourth intercostal space. Okay. And down. The mitral site is in the fifth intercostal space with the mid-clavicular line, just here. Okay, so it's good. There's no extra sound, I can just hear the love dub. Now I'm gonna do the bell now, okay? So in the aortic, pulmonic, Erb's point, tricuspid, and then the mitral site. Okay, good. Everything's good. So now I'm gonna identify and palpate for the PMI, or the point of maximal impulse, okay, which is where the apical pulse, okay? So it's gonna be in the 2, 3, 4, 5, and then it's in the mid-clavicular line, so it's here. Okay, now I'm gonna listen to it and note for the rate, for the rate, okay, and the rhythm. Okay, so I listen for 30 seconds, which is 35, and I'm just gonna multiply it by 2, it's 70. Okay, but if the rhythm is irregular, we need to check it like a full minute. Okay? So now, I'm gonna need for you to lay down. Is that okay for you?
Sure.
Okay. So, okay. So first, I'm gonna check for hips and lips. So hip and lips are the palpable lifting sensation. Okay, so if I will feel that one, then patients can have like a right ventricular hypertrophy. Okay, so I'm gonna start first here. Okay, good. Now the next one, we're gonna palpate for trill. So trill is a vibration felt under your skin. Okay. So for trill, when there is a positive trill, meaning that there is like a stenosis. Okay. So okay. So negative. There's no trill. Now I'm gonna do the auscultation again, using the diaphragm. Okay. Okay, I'm gonna start for the aortic on the right side and the second intercostal space. And then moving to the opposite side on the left, on the second intercostal space is the pulmonic. And then third intercostal space is the Erb's point. And fourth intercostal space is the tricuspid. For the mitral side is in the fifth intercostal space in the mid-clavicular line. Okay? Okay, so good. Now I'm gonna do the bell. Okay, the aortic, pulmonic, Herbs point, tricuspid, and the mitral side. Okay, that's good. So everything's good. Now we're gonna check for. Okay, I'm gonna check first for the mitral valve or the mitral stenosis. Okay. So I want you to. That's your left, right? So you're gonna turn on the left lateral.
Like this.
Yep, like that.
Okay.
And then I'm gonna listen in the mitral side because mitral stenosis can be heard using the bell on the mitral side. Okay, so it's here. Okay, can you take a deep breath and then breathe and then hold it? Okay, good. So the one that we're looking to hear there, if there is a problem, is there is like a decrescendo blowing murmur. So I didn't hear anything. Okay, so good. Now the next one that we're gonna check is for the aortic regurgitation. So if there is an stenosis in the aorta. Okay, so can you sit down? Sit down and lean forward. Okay. With the aortic, we need to choose the diaphragm. Okay, so it can be here in the left lower sternal border. Take a deep breath and then breathe and then hold it. Okay, I didn't hear any decrescendo blowing murmur, so good, because when you can hear that sounds, meaning like you're having a problem with your aortic valve, like it's not closing completely.
Okay.
Okay, so now I want you to lay down again. I'm sorry.
Same
Position, but just straight.
Okay.
So I'm gonna check for the jugular venous pressure. Put it here first. And then I want you to look on the right side. Oh no, that's left side, right? Yeah, left side. Okay. Just like that. Okay, I can see there the carotid pulse. And then the jugular venous is there. It's above the sternal notch. And then you can note too for different waves. So the A waves is like the atrial contraction, and the ventricular is for the B wave is the ventricular filling. Okay, so this test is they're measuring this, but for this assessment we're not gonna do the measurement. So this is to test for your fluid status. Okay, so everything is good.
Okay.
So now I want you to sit down again. So now I conclude my assessment. Everything is good. Do you have questions for me?
No, none. Thank you very much. I appreciate it.
Oh, thank you very much too, and have a great day.
Thank you.